CUNY School of Public Health. We are super honored today to have the opportunity to host Dr. Jason Wang for our grand rounds. Dr. Wang is the professor and director of the Center for Policy, Outcomes, and Prevention at Stanford University. He is trained in pediatrics as well as health policy, and has worked in academic, private sector, and government settings. Throughout the COVID-19 pandemic, Dr. Wang has lectured and written a great deal comparing different responses from different parts of the world. And in particular, he was very famous early on with his JAMA publication outlining some of the unique political and technological conditions that have led to relatively successful responses to the COVID-19 epidemic in Taiwan. So I think today he's going to bring to us some really unique perspectives on the role of culture and psychology in the COVID-19 response that we see across different countries. So without further ado, I'm going to hand the mic over to Dr. Wang, and we will save questions for the end of his talk. But if there are points that you want to make or questions that you want to jot down before you forget, please do feel free to use the chat box. All right, so Jason, welcome to CUNY. We wish we could have hosted you in person, but it's a real privilege to have you with us today. Thank you.
Thank you very much, Terry. Can you hear me okay?
Yes.
Okay. So, so today I'm going to talk a little bit about the impact of culture and psychology on COVID response. And I'm just going to start by showing you some differences in outcomes from two democratic countries. And so on the left is Taiwan. It has a population of 23.5 million. And so the total cases so far as of today is 1,110 cases of COVID with 12 deaths. On the right is us, the United States. We have a population of 328 million. And as of today, we have 32 million cases and 573,000 deaths. So if we look at sort of the prevalence of disease, based on what's the population that's been tested, Taiwan is 0.0047% of the people infected with COVID. And in the United States, we have 9.8% of the people infected with COVID. When we look at the world population of 7.6 billion, and we see as of today, there are 149 million people identified of having been infected with COVID, with over 3 million deaths. And because the majority of the world lack appropriate diagnostic tools to actually identify COVID, so the real number is probably much higher than the stated number. Now, you could also see the curves on sort of when things started to, when things happen and how they have been for both Taiwan and the United States. We have had a peak around between November and January of November last year, January of this year in the United States. And then we seem to be on a taper at the moment. And Taiwan has pretty much has very low case numbers throughout. And we have to all be very vigilant because many countries are now in the second or the third wave of the pandemic. And just because some countries are doing well right now doesn't mean that they could continue to do well until all the countries in the world, the majority of the people are vaccinated. I think there's going to be a long slog, a long fight. So this is our first paper COVID, and we've subsequently published around 11, 12 papers on COVID. But what early on, what we're trying to understand is what are some of the things that governments could do in response to COVID. And in the case of Taiwan, they've used big data. Basically, they've integrated the immigration and customs data set, so they know who's coming from abroad, and integrated with their national health insurance data set, so that when a patient is seen by a doctor or nurse, the doctor would know that this person just came from abroad, and if they have symptoms that resemble COVID, then they will test them, and then with isolation and so forth. They also deploy new technologies such as cellular signals to track people. So these are the signals that you have on your phone, the number of bars on your phone, to optimize the quality of the sound. And they use that as an approximation method to know where people are and make sure during quarantine they don't go too far. They also have a system of proactive testing based on risks and where people have been using these cellular signals. So in the case of Diamond Princess, before I went to Japan, I actually first docked in the outskirts of Taipei in Taiwan, where 3,000 people disembarked and visited 50 places. And they were able to send cellular signals to people, say, hey, you've been into these 50 places, and please come and get yourself checked to make sure you didn't get contracted with COVID. So these are the things that governments could do early on. So, but I was actually more interested in sort of the cultural determinants of health, if you will. So are there things other than the things that government could do that are more fundamental to the population? And how do you change culture, and how do you change the psychology of a pandemic response? I think that's very interesting to me. And you could see that just culturally, if you see any sort of martial arts movies, you could see how people wear their masks. They try to cover their face and just left the eye open. But the American icon is the Batman, which is cover the eyes but leave the mouth open. And so even in the issue of wearing masks, there are cultural differences. So we we started to think about a model to assess sort of health behaviors, and this is a paper that we published in JMIR based on the work done last year. And so we developed this conceptual model basically to look at individuals. So individuals have their health beliefs, and it's based on things like perceived susceptibility to acquire disease. So the people feel that they're gonna get COVID, and the perceived severity, if they get COVID, do they think they're gonna get very sick? And the perceived benefit of certain measures that they were asked to take, like wearing masks or social distancing or washing hands. And the perceived barriers to these recommended measures. Such as, can they actually get the mask? If they were asked to wear a mask, can they actually purchase the mask? Are they available? Are there soaps available for them to wash their hands and so forth? And finally, self-efficacy. Do they feel like they could do all these things? And so in carrying out these preventive measures. And a lot of people early on told me that they've noticed that Asian children could wear masks, but not American kids. And I'm an American pediatrician. I see lots of kids, and from my point of view, kids are toilet trained around the same age, between 2 to 3, and American kids definitely get toilet trained because if they want to, enter preschool, pre-K, they need to be toilet trained. And so it's more about neurodevelopment and establishment of a habit. So I will tell parents, I say, hey, your kid's toilet trained. If they're toilet trained, they could wear a mask because it's much easier to wear a mask than to toilet train. So on top of all these things, there's the sort of the modifying factors to these behaviors, such as demographics, gender, age, and education, and in some cases health literacy. COVID is really has really posed a challenge to everyone, because most people didn't take virology in high school or college, and viruses are very tricky. Most people didn't take immunology, so when you try to talk about vaccines, you have to speak in a way that people understand what an immune response is. And certainly when we're asking people to do the things that's required to contain the pandemic, there are sort of some gaps in terms of what their cultural beliefs are about how to protect themselves and transmission of the virus. And then we've been sort of working in the space of public policy and community advocacy, and a lot of times that people get their information very differently from different sources, and so depends on where you get your sources, what you believe might be different. And with social media, it's we're creating a lot of echo chambers where people are friends with the people that think like them, and then they join groups that think like them, and so it's very difficult to sometimes convince people of another idea or the alternative. And finally, once they get the recommendations from a trusted public source that they believe in, they're going to act. And whether it's if they decide to do social distancing or hand washing or wearing a mask. So what we did early on was we filled in a survey of 70,000 people through social media in 4 countries. So in the United States, in Mexico, in Taiwan, and in Hong Kong, and where people have access to social media, and we're trying to figure out what their perceptions are, and in fact, we did find that self-efficacy is probably the most important thing, that people have to believe that they could do it. And so convincing people that they actually could do it and they should do it is very important. There are also people also act on perceived susceptibility and perceived severity. If they believe that they will get the virus, or if they get the virus, they'll get very sick from it, and so therefore they will take certain actions, but it's not consistent throughout. So I've decided to sort of focus on sort of 2 democracies, Taiwan and the United States, and then also look into other countries with respect to culture. So I actually spent some time, several months in Taiwan, trying to figure out what they did. So just so everybody knows, so Taiwan is about 81 miles off the coast of China. And it has 2 major political parties, the Democratic Progressive Party and the Nationalist KMT Party. And so since 1996, it has held direct elections for its presidents and mayors. And about 75% of the people voted in the last election in January of 2020. So very high participation in the democratic process. And these were the gatherings the day before the presidential election, where you're seeing close to 500,000 people gather in each camp, and this happens to be January 10th, 2020, right before the pandemic. And actually, I was right there. I was there to observe the election, and during that time, there were already chatter from the internet that there's a new coronavirus coming, and I was actually very worried because look at all these people gathering in around the close to the office of the president. So looking back, what I was trying to figure out was, well, what made their response very so quickly this time. And we could trace back to the impact of SARS in 2003. And so this is a map of the countries worst affected by the SARS outbreak. So China was obviously the most affected, and Hong Kong, and then Taiwan has 73 deaths and 346 cases. Now this looks like small numbers compared to what we're facing right now. But at that time, nobody expected coronavirus to have such a big impact, particularly very, very high mortality, much higher than COVID-19, because it's sort of a deep lung infection. So by the time people realize that the patient has COVID, it's spreading in the hospitals. Okay, and so what happened during that time is that in Taiwan, in 2003, 94% of all the known infections were transmitted inside the hospital. So that caused a lot of scare in the hospital setting. All major hospitals were either fully or partially shut down. And doctors and nurses quit for the fear of catching the disease because they didn't know what to do, and there was inadequate hospital infection control. This is in 2003. The fever clinics were set up too late outside of the hospitals to prevent infections in the waiting room. So people were getting infected in the waiting rooms. And a fever is a major symptom for SARS. Not so much so for COVID, but for SARS, it was a major symptom. There was apparently an infected laundry worker at one of the hospitals that became a super spreader. So this person was doing laundry for all the hospitals and was basically spreading in different hospitals, and particularly the Hoping Hospital that he was primarily working at. The entire hospital, 450 beds, was shut down, and they quarantined all 930 staff and 240 patients in the hospital, so they can't get out of the hospital. So this caused a big scare because not only patients, but doctors and nurses were all locked in the hospital. Quarantine patients in other areas evaded isolation despite threats of steep fines. And so people didn't know what a quarantine is in 2003. They thought that they want to get incarcerated, and they didn't want to get quarantined, so they will escape. And so many people just ran away before the hospital were shut down and locked in. And so I went and I talked to the head of the task force, the command task force during SARS, and I talked to the head doctor who got locked in with the staff. This was a former minister of health, and he volunteered himself to go in and to handle the situation. And so I talked to these two individuals. One is the head of the task force, and what they told me was that, after this incident, that they really had reflected on how to handle it better in the future, and so they decided that they need to be nice to people during quarantine, that make people feel comfortable, that make people feel that they were cared for during quarantine. So they decided that they were going to bring them food. They were going to check up on them, and if they have symptoms that's getting worse, that they were going to get these people to care right away. And in some cases they had discussed whether to pay people during quarantine, because you quarantine people so they don't infect other people. So there's a public good coming out of this. And then they decided that they need to educate the public on what to do in an epidemic and a pandemic. So they had exercises of school children, actually, where they asked them to take temperatures for 10, 20 consecutive days and record them. So it becomes like an exercise that every school needs to do and just to practice taking your temperature and record them and submit them to the school. So if you have fever, you don't come to school. And practice washing hands. So they started to have these public service announcements on, sing 2 birthday songs, and you wash your hands with soap, and so that becomes sort of a routine of how they would do this. So so this is my daughter. She happens to be 2 years old during SARS. So, and she was visiting Taiwan, so we made her wear a mask. And the thing about making kids wear, and so she's not yet 2 at this time, close to 2, is that you have to make them cool, like you have to make a nice mask so they want to wear it. And kids imitate adults. So if the adults wear masks, the kids say, I want to wear a mask too, and give me a really cool one, and they will do it. And so so it's actually I think from the sense of informing the public, I think there's a sense of self-preservation. Like people don't want to die, basically. And this is certainly the case in Taiwan. And then a sense of how to build good habits. So we now had a chance to look at hand washing habits for 20,000 kids, looking back during the SARS time, and then to see if they were establishing habits early on, and then and what happens during COVID if they had established good habits during childhood, and it's very highly correlated. So it tells us that if you establish good habits early on, it's easy to reactivate it. It's like riding a bicycle. So it's very important, I think, to recognize that kids could be trained very early on. So as I look back, and I've spent close to 6 months talking to different people, including the president and the vice president of Taiwan, and the ministers and so forth. There's definitely a cultural and psychological component to the response. Liberty is a relatively new concept in Taiwan. It has a long history of occupation by the Dutch, the Chinese, and the Japanese. And so, and then it had a long history of martial law under the KMT. It started in May 1949 and lasted until July of 1987. So a very long time they were under martial law. Even though there were student movements like the Wild Lily and Sunflower movements, mostly these student movements are mostly to advocate for liberalization, democracy, and open elections, and open dialogue. But still, these are relatively new concepts. So the first presidential election took place in 1996. So that was about 25 years ago. 25 years ago. And as one could imagine, so during the occupation and during the martial law, obedience is the key to self-preservation. If you try to sort of protest and things like that, a lot of people got sent to jail or they get killed. And so, particularly during the occupation. And so, so people are trained to basically do what others told them to do. Until very recently, until 25 years ago, when they have actually a more active voice. There are also traditional cultural influences like filial piety, is basically respect and care for the elders. And for many people that I talk to, wear masks to protect themselves and their parents or grandparents, older people, are important to them because they go home. A lot of them actually live in multi-generational households. Not all of them, becoming smaller units, family units now, but They do visit their parents and grandparents quite often. And there's a sense that even in school that sort of, obedience is it's often considered a good thing when you're trying to, cram a lot of things in to take the national exam for college. And so it's a little bit different from what we have here in America. And then there's a sense to make oneself and others feel comfortable. So if you if you take the metro in Taipei, for example, even before the pandemic, a lot of people were wearing masks, and these were all healthy people. And one, that they don't want to catch any germs, and two, that they want to feel comfortable and make others feel comfortable. So because the metro tend to get crowded. So that was already a behavior that was established, perhaps even, before SARS. I think wearing masks is quite common. And there are some other cultural elements like social solidarity that took some time to build, but it's there. They have had a national health insurance program since 1995 that covers all citizens and foreigners working in Taiwan. And there's a sense that we're in this together mentality. So willing to sacrifice some personal liberty for public safety and societal freedom. And so the best example is that, and I think it's still true today, that when one goes to Taiwan, there's a 14-day quarantine period. And then followed by a 7-day self-management where you're not supposed to go to the restaurant, even during those 7 days. So 14 days you can't go out, and people will check up on you. So and will track your phones for cellular signal. So if you go outside of the cellular signal that they allow, they'll track you down. And so the way that people explain to other people, or at least the government explains to the citizenry, and the citizenry as they reflect, is that when people coming in, the 14 days is to guarantee that they are not infectious. And even if they had the virus, after 14 days, probably not very infectious. And then afterwards, they could enjoy the freedom. So if the virus are coming in and we let them in, then nobody has any freedom. So basically, these 14 days are sort of self-sacrifice for greater freedom later. And so that's a very interesting concept. And then also the risk-averse mentality, as I mentioned before, the sort of probably is related to the long history of occupation, that to stay alive, basically. Okay. So to prepare for the next crisis after SARS, and the government it's a bipartisan effort. Basically, they had amended the Communicable Disease Control Act in many ways, and so it's a bipartisan effort. Basically, it mandates that the government count the stockpiles of protective equipment, and that there needs to be enough reserves in every single hospital so it could get activated when needed. It set up a central command center that integrates 3 previous command centers, so including the biohazard command center, the infectious disease command center, and so forth, and under one central command. The amended law allows for regulation of gatherings, entry and exit of people, traffic and evacuation, and travel restrictions. And allows for penalties for violating home quarantine, or hoarding resources, or disseminating rumors, fake news. It could sort of fine individuals and institutions. And so also allows for tracking and management of people under infectious risk, and mandates geographic location of total number of patients to be made public. So it's usually done in the county level, and allows the use of public properties for the use of private lands for production of necessary equipment, such as masks. And so when the command center is activated during the pandemic, government will have special powers, but that power will expire after a year. So basically, the government needs to first activate the command center, and then all these laws get activated simultaneously, and then it will expire after a year, or it has to get renewed if it doesn't expire. So these are the things that was done at the government level, with consultation from the citizenry and also from legislatures on both sides of the aisle. So one of the things to pay attention in a democracy is that you can't just do whatever you want. It has to be have the support of legal support, and it has to have public support, and building trust and communications is extremely important. So I spoke to the President Tsai, and she is, she was elected. This is her second term, and she said that right away. She realized that this was going to be a political issue, and so she wants to make sure that that professionals are in charge for a pandemic. And it just happened that during the pandemic, her vice president Chen, is a very famous epidemiologist trained at Johns Hopkins, and was a former minister of health and former head of the School of Public Health in Taiwan. So basically, she put him in charge, and he's an epidemiologist. And so they will speak to the public in the office of the president. So that's the level that this gets raised. And then the Minister of Health and his advisors will hold daily briefings to the public. And basically, these briefings are very well attended. I think most people around 2 o'clock in the afternoon will tune in to the briefings, and we'll try to see how many cases are each day, and then and who got it from who. So everybody was being trained like an epidemiologist. Like they had these pedigrees, like pictures where this person got it from this grandma gave it to the grandchild, and they were sitting, how many feet apart, for how long. Basically, they have very detailed mapping of that. And so this type of communications establish trust in the government. I wanted to sort of to turn to the United States, and so the U.S. Even before founding, even before the Declaration of Independence, in 1775, Patrick Henry in the Second Virginia Convention basically said, "Give me liberty or give me death," and that set the tone for sort of it's a foundation for this country. Liberty. And this legacy continues. So, when I was in middle school and in high school, we had to go to homeroom, right? Homeroom class. And so what do you say at the end? The Pledge of Allegiance, indivisible with liberty and justice for all. And you have to say it like a million times. Basically, every day you have to say it. This is sort of deeply ingrained in the American psyche. So this is New Hampshire, right? Live free or die. So this is a very different a mentality, the American mentality. So the people who came to the U.S., the Puritans, came here for religious freedom, and immigrants take more risks than non-immigrants. They really believe in liberty, and that's why they moved. They are more risk taking. And so this got translated, perhaps misplaced, liberty during the pandemic. You know, give me liberty or give me COVID. And I think we've all seen this poster in these major rallies. And there's individualism. So many of us believe that you know, individualism is very important, and that's what makes America great. But during the pandemic, it turns out that it's not only important to protect oneself, but also to protect neighbors, family members, colleagues, and particularly when the virus spreads very quickly and you have to try to stop it. Some people misuse the slogans from Black Lives Matter and turn it into no masks. And so this is another way that that sort of the expression during the pandemic that's not helpful in when one tries to stop the spread of the virus. So you know, when we come back to the American culture and the psychological elements, protection of liberty is integral to the founding of America. It's, as I mentioned before, the Puritans, and not only that, the Wild West. When people are trying to explore the Western frontier, is the survival, the persistence, and the merging of people willing to take risks that made it happen. And you know, when you try to limit the spread of a virus like COVID, you know, when you ask people to have frequent testing, contact tracing, and quarantines, this really threatens a lot of people's sense of privacy, confidentiality, and autonomy, right? Personal freedom. Most Americans, many Americans, not most, but many Americans do not accept these concepts. And that's why today, even today, contact tracing has not been that successful in the United States. There's a cultural questioning authority, pushing beyond limits. And this, you know, during a time when you need to adhere to, you know, certain rules like wearing masks and social distancing, washing your hands, this become a sort of anti-mask and anti-restriction protest. This reminds me of these dress codes. Like, you know, if you ask high school students, you know, to have dress code, they just outright just reject it. This is us. This is we don't like to have these kind of rules. But there are positive sides to this. So the U.S. pioneer and cowboy mentality has really allowed us to become a bright and innovative country. We send people to the moon, and now we send people to Mars. And even today, there was I think an interview with Elon Musk, and he told journalists that yes, the first people who goes to Mars are probably going to die. That there are probably going to be some sacrifices, and I think this is very deeply ingrained in the American psyche of being a pioneer and immigrants to take more risks than people who are left behind in their homeland. But some of these risk-taking behavior and mentality is impeding public health measures, right? Because, you know, when you're not wearing masks, you're not only endangering yourself, you're endangering the people around you, but particularly your family members. But this pioneering spirit also allows the development of diagnostics, vaccines, and therapeutics at record speed. So the operational warp speed is incredible. It's probably the most impressive scientific endeavor in decades, where vaccines are basically developed within months and tested, and now people are getting shots, and now all Americans qualify to get a vaccine above 16, and we're almost finishing clinical trials now for, you know, kids 11 and above, and then we'll be going down to younger kids. And so this is all happening very rapidly, and it's because of the pioneering spirit. Um, Many people during the pandemic had told me that they're losing enjoyment in life. And initially, I didn't quite understand that, but they really meant it. And this is something that maybe as a healthcare professional, I really have to listen very carefully, because this is the cause of depression. If they're not enjoying their lives and they're not pursuing their happiness, and certainly, we're seeing mental health going up. We're seeing, certainly depression, suicides, and going up, domestic violence, divorces, and this is important to pay attention to. So that I think being part of American is to be able to enjoy one's life and pursuit of happiness. And this is very deeply rooted also in our culture. There are historical burdens of public distrust in government. The most famous example is the Tuskegee syphilis study on African Americans, male, that lasted for 40 years, where people were not told that they had syphilis, and so that scientists could follow the natural course of illness. And this lasted 40 years. And so this really has subsequent sort of very negative implications for vaccine hesitancy and government initiated public health orders, because it's hard to trust the government when they tell you something. And so this case has been used in every single IRB, Institutional Review Board, sort of human subjects training on what not to do, and particularly for informed consent and all these other issues related to doing experiments on human subjects. There's been a long history of excessive use of force by law enforcement against Blacks, African Americans, and other Blacks from Caribbean and so forth, and that's still happening today. And so these historic burdens place sort of distrust in when government try to initiate something. We also had a highly divisive political environment and rhetoric in last year's presidential campaign. So during an election year, things get pushed to the extreme, and so and a lot of fake news. So that was most unfortunate. There are other cultural issues that are important. So some cultures, whether in America or elsewhere, have large households and multi-generation households, and so and this is very important to address. What to do if you have a large household and some members of the household have contracted the virus. And I think this particularly problematic now as we look at India. With the rising cases and living in crowded conditions, and other places in Latin America where people also tend to have large families and gather. And these are some of the issues that has to get teased out, because virus does not distinguish between family members and non-family members, that it will go and infect everybody if it could. Other cultural issues like cultural greetings, we have seen in many Western cultures, or where kissing on the cheek is common. But I think since the pandemic, people have temporarily halted that type of greeting, and even even handshakes, right? People don't really want to shake hands. I think in America we do the elbow thing, and I think people from Israel told me that they do the tap on the heart, and then Asian people now do this, New Year's greeting thing. So everywhere is reinventing the way they greet people and make sure that it's nothing personal, but they just don't want to get infected. Religious gatherings, part of it is culture, part of it is religion. Certainly in Taiwan, they have this goddess Mazu, where every year they will the believers will circle around Taiwan, hundreds of thousands of people, and they will circle all around Taiwan for days. And at the height of the pandemic last year, the religious leaders got together and tried to decide whether or not they should have the event in 2020. They had lots of meetings because, as you can imagine, you have 100,000 people circling around the island. There's also business opportunities, right? Everywhere they go, things will sell out, and it's good for local economies, but also bad for infectious disease control. So finally, they came up with the solution, and they say, do not let the Mazu goddess worry. That don't make the goddess worry. So let's delay it until the pandemic is under control. And so that was one way to deal with religious gatherings, which I thought was done well. There are other, religions that obviously gather big crowds, and I think all needed to make adjustments on the number of people attending a church or mosque or temple, to basically be able to have more infectious control. In some cases, people needed to write their names down when they go into a religious event so that it's easier for contact tracing. And so people around the world are making adjustments to prevent the spread of the virus. So what are we learning in terms of cultures and psychology? So in addition to the things that government could do, really, and even with democracies are particularly hard because you need to have the support of the public, and you need to have legal support as well. And in the case of Taiwan and the United States, I think the difference may be the cultural values and the way we're set up. Even in democracy, to build a civil society, I think we need to really pay attention to culture and the psychology of the citizenry. Otherwise, it's hard to implement any preventive recommendations. There needs to be a balance between safety and freedom. It needs to be supported by law in the best scenario. So I think we should think about which law we should be amending in the United States so that the next time something like this happens, we could respond faster in a more integrated and coherent way. We do have a limitation, and which is for pandemic control, which is we have 50 states and the federal government, and the health is mostly the responsibility of states, and federal government basically regulate interstate commerce. And so somehow we have to figure out a way to be able to gather the necessary data and respond quickly in our federal system. There are changing cultural norms during the pandemic, and addressing psychological components are important. Sometimes you have to use both carrot and sticks and make it bearable for people. A lot of places have lockdowns for 3 to 4 weeks, and I think there's a rationale for that. One is psychologically, 3 to 4 weeks is what people could take, probably. But more realistically, I think the average American has a median savings of $3,500, and so after 3 or 4 weeks, you're going to run out of money. So people have to go back to work, and about 40% of Americans could not handle an extra bill of $400, and so there's just not enough savings to lock people in for a prolonged period of time, unless the government kept on printing money, which is what it's been doing, but there's only so much you could do. So we have to make it sort of a temporariness that, make the measures bearable. There are public health infrastructure requirements that to have them, you need social solidarity. And the participation from citizens for collection of data for pandemic control, like contact tracing, I think needs to be communicated, particularly if the infection is spreading really fast. And getting to the contact in a day is very different than getting to the same contact in 7 days, because the disease would have spread multiple cycles. Given how fast it's been spreading, and with the new variants, we have to be vigilant as well. So I'm gonna actually stop right here and to see if people have questions or comments. I'm happy to answer or respond to them. Some of the things I just simply don't know. This is a very complicated issue, and so. But I'm happy to take any questions. Thank you.
Thank you, Dr. Wang. Really fascinating talk. I think some of the cultural issues that you talk about are certainly relevant, even beyond COVID-19. I know that in many chronic disease topic areas, such as obesity, public health as a field, continues to struggle against the American notion of individual responsibility. And so some of these cultural barriers, I wonder, do you think that it's a generational effort, that it would take a whole generation to actually kind of rebalance this delicate affair between freedom, individual responsibility, and liberty versus social solidarity? And where do you cut into that as a field, of public health? Like, where do we even start?
I think a good place to start is to talk about it first, so that people are aware that there are these issues. That there's, we have a very diverse society in the U.S. and different groups. Most of my patients are Latina, Latino, mostly Spanish speaking. I work in a federal qualified health center. 99% of my patients are Medicaid, and so they have very different concerns than the concerns that I have. A lot of them have to go back to work. They are the people who work in grocery stores and Amazon, and that bring us food when we order online, and so they have very different concerns, and certainly we have to be very inclusive as we make recommendations, but also address the individual groups' concerns culturally and economically, and that's what makes this really difficult. And many fake news spreads much faster than real news, than real facts, because it's so sensational. So when you hear something really strange, it spreads really fast. And one of the things that I think Taiwan had benefited in 2020 is that it finished its presidential election on January 11th, 2020. If the election is like us in November of 2020, then there'll be a very different communication strategy for the government, because then you're in the middle of the election. And we happen in the US to be in the middle of an election where everything gets sensationalized, and at the beginning of the pandemic, you don't know what's real. And certainly even the World Health Organization had to walk back several times about wearing masks and about, border control issues, because it just, as the emerging evidence, you have to wear masks. And so, our CDC also had to walk back a little bit on the wearing masks. And so, nothing is really certain in the beginning of the pandemic. But one thing for sure is being prepared, being sort of, now you're sensitized to what could happen in a pandemic. How will you do differently next time? what kind of laws do we need, at the federal level that would allow us to get, pull together the information and the resources faster. So, one of the things that I think was very critical in the beginning, at least for Taiwan, was that they ramp up their mass production from 2.2 million a day to 20 million a day in 5 weeks. So basically every citizen could get one mask every day because they were making 20 million a day. And they use their national health insurance system to hand out the mask. So if you bring your national health insurance card, and then every 2 weeks you could get 10 masks for less than 15 cents each. So you're paying like $1.50 for 10 masks. And every 2 weeks you go pick yours up because it's got your name on it. And so we don't have this kind of public health infrastructure. So we're still trying to figure out who's eligible for vaccines. So let's say our insurance system, we change every year. Nobody really knows who their patients are. So if you want to say the first eligible group is the doctors, okay, we get that, and nurses. But then above 65, do you know who's above 65 in your patient panel? You have to do an IT exercise. You have to get the IT to work on it. And I left Boston 10 years ago. I got a text message from the Mass General saying that I should go get my shot in Mass General. I left Boston 10 years ago. That means nobody really knows where I am. And that's a big issue with pandemic control. So we have a lot of issues that we need to anticipate and prepare, and prepare not only the government and the infrastructure, but also the citizenry. And that's why I think culture is important to prepare the citizen, to make sure people understand what's going on, sort of health literacy wise and language literacy, and sometimes electronic literacy. Like if we're disseminating information electronically, make sure they could know how to access it. And so all these are very important things to consider.
Mm-hmm. Yes, a lot to tackle. Let's open the floor up. I think everyone is able to unmute unmute their mic. So folks, if you have questions, feel free to unmute yourself and share your question. There's a question in the chat from Mary. The question speaks to sort of, what your thoughts are. What are you observing, Jason, in terms of, population trends? Are people more likely to observe recommendations because they've gone through this current experience, or do you think they'll be less likely because of pandemic fatigue? Do you see any changes in terms of how people think about these issues?
Definitely pandemic fatigue. Okay, so example from the heart. Okay, so you want to keep the heart pumping, you can't just squeeze. You have to let go. So you have to do both. You have to squeeze and let go, squeeze and let go. So the moment you let go, you let the blood comes back into the heart, so you can squeeze again. So basically, you have some measures, and then you have to relax some when the risk is lower. So I think that's what CDC is doing. So the CDC yesterday just put out a recommendation that if you are vaccinated, and when you go outdoors, and if it's not too crowded, you don't have to wear a mask. And so that's a way to incentivize people to get vaccinated. So it's the double meaning. So you want to get people vaccinated, and then so if you're vaccinated, when you go out, you don't have to necessarily wear a mask if it's not too crowded. And so when things seem to be coming down, you can relax a little bit to prevent sort of the pandemic fatigue. But then when things get worse again, you need to be able to inform the public right away, and then to reinitiate the set of things that you want people to do right away. And that requires good communication. And so, certainly that requires also trust in the government response. And so, communication with the public is extremely important, building that trust. And the best thing is if you do it right the first time. Like, if you have a misstep the first time, then people are like, are you sure about that? So then if you being prepared, then the chance of getting the right first step is higher. But definitely you have to relax and and put carrot and sticks, and also depends on where you are with the pandemic.
Mm-hmm. Any other questions from the audience? Don't be shy.
The other thing is that we're facing variants now, right?
Mm-hmm.
So that's a new ball game. Basically, even if everybody's vaccinated, it may be that people have to get a third shot with the variants
Mm-hmm.
if it's not protective enough from the first two shots. And so we have to be vigilant, even if you're in a crowded place, and even if you're vaccinated, if your area have variants, you should probably still wear a mask, right, in a crowded area.
Question from Jorge. Any strategy that really, can you hear me, Jason? Can you hear me?
Can anybody hear me?
We can hear you, yes. Are you able to hear me, Jason? We just lost your voice. Now we can't hear you. Can you hear us? That we can't hear you now. No, we can't hear you now. Are you able to see, do you have a wired set of earphone? Michelle, do you have any suggestions for Dr. Wang? Maybe it's a setting issue. Everyone just hang on tight. Let's see if we can solve this in the next couple of minutes. Oh,
hear me now?
Yeah, can hear you. Yes, you're back. Can you hear me? Are you able to see the chat? Because if you can read the questions in the chat, maybe you can just answer directly because we can hear you. Can you hear me, Jason?
Yes.
Okay, we can hear you now. So,
okay.
Yes, so let's continue with a couple more questions. We have a question from Jorge. Broadly speaking, what are your thoughts in terms of strategies to improve the vaccination rate in the US?
So can you hear me okay?
Yes. Mm-hmm.
Okay. So I think one of the ways is to address people's concerns right on. So there are obviously some concerns about sort of the side effects of the medication, the vaccines. And uh, there needs to be sort of more public outreach, particularly for different kinds of vaccines. People might be confused with the common side effects. And so, for example, in AstraZeneca, the thrombotic events, some people are confused with like Pfizer vaccines. And so they didn't want to go get their second shot of Pfizer, even though it's AstraZeneca vaccine that has these really rare side effects. And so, and you know that again, I mean, this goes back to uh, the communication strategy. So you have to do outreach to communities to make sure that they get the right information, and also make it easier for people to get the vaccine. So now it's eligible to almost all the adults. It's eligible to all the adults plus kids above 16. Make sure that you have these sort of drop-in clinics where people could just get their shot, and in addition to the appointment system. And so just make it widely available. Make sure you address the concerns for vaccine hesitancy, um, and make sure that it's in different languages so that people hear it from their native language where they're most used to, and could probably trust more.
Mm-hmm.
Um,
So given the
a
US,
lot of community outreach.
yeah, given the US is really, large and, really diverse, the idea of building social solidarity, seems daunting. Although, as you pointed out, there are some cultural elements that seem to be widely shared by Americans, and that have been ingrained in all of us. But at this juncture, though, how do we go about building this sense of social solidarity, around social issues, public health issues? Is it a question of education, or are there like technological solutions, civic tech, for example, where we can foster more citizen science in building kind of a trusted network of information and knowledge? What are your thoughts regarding this?
Yeah. So I think we are building some sort of gradually. I think we're building at least social solidarity around pandemic control, because I see more and more people wearing masks, and than 2020. I mean, right now almost everyone is wearing masks, and the few that they're taking their mask off probably because they got the vaccines. And um so I think we're slowly getting there. uh the um the idea is that if you center around what people care about, you know themselves and their family members and their colleagues. And certainly we've seen a lot of families affected by the pandemic, and a lot of people's relatives and friends are dying from the pandemic. I think that's sort of the best way to convince people that it's not just about yourself. It's about the risk to yourself, your family members, and your friends. And the quicker that we can contain the pandemic, the better off it is for everyone. And one quick way to get there is to get the vaccine, to get vaccinated. And then we have to be transparent about the side effects of the vaccine. So that's also one way to build trust. Yeah, if you're not transparent, people say, what are you hiding from me? So for the recent Johnson and Johnson sort of pause, and then afterwards, you need to put a label on it that in very rare circumstances this could happen, and if this happens, please tell your doctor right away. And so I think that kind of strategy is to make sure that people understand that you're there to help them, and to protect the public, and to protect public health. So we have to just focus on that. It's not about ideology. It's about protection of public and the public health.
Great. Another question from the audience. Dr. Wang, what are your thoughts regarding CDC's latest recommendation that if you are vaccinated, you do not need to wear a mask any longer outdoors? Do you think that there may be unintended consequences with regard to this new recommendation, or is this part of the restrict and relax strategy that you were talking about?
Yeah, I think people might have difficulty defining crowded spaces because that you don't have to wear a mask if you are not in a crowded space. So then you have to define what is a crowded space.
Mm-hmm.
And most people have difficulty doing that. And so I would say that for me, I typically just bring a mask with me, and I put it here. And so if anybody is coming too close to me, I'm just gonna wear a mask, even outdoors, right? And typically I wear a mask anyway, always indoors. I always wear a mask. But outdoors, sometimes you're in the park and there's like nobody around. I mean, okay, take your mask off a little bit when there's nobody around. But then the moment that people start walking towards you, you put your mask on. And it's actually now I think I consider it common courtesy. It's a courtesy. It's a courtesy, like it's to tell the other person, yeah, I care about you too. I'm gonna put my mask on, and I also care about myself. And so this has become an etiquette, a common courtesy, and definitely in a crowded place, you have to wear a mask because nobody wants to talk to another person too closely now, without knowing that both sides are masked. Um, and But again, I think it is a strategy to get more people to get vaccinated. And outdoors, really, the risk is lower
Mm-hmm.
because the air free flows, and so the moment the virus is there, it's diluted. But not if you're too close.
We saw in Asia, after SARS, mask wearing really became increasingly socially and culturally accepted. And as you pointed out, even before SARS, it wasn't really a weird thing to see people wearing masks. I think back then people were more concerned about air pollution, for example, so they would wear a mask if they're, riding a motorbike, so as not to inhale, dirty air. But going forward, even with increasing vaccination, do you anticipate that mask wearing and other preventive measures will be in place over the long term?
I think that the next time around, people will pick up bands much faster. This time around, it took us a while to figure out where to get the masks,
Mm-hmm.
and then people start making them,
Mm-hmm.
right? And then the vendors, jump into it, and then now, you could get the mask. And so, in order to wear a mask, you just have the mask, and you just have the supply chain to make the mask, and it could be, I think next time around, people will be triggered to act quicker. I don't think it'll necessarily be a norm to our society, but I do believe that in crowded spaces, in metros, that you're gonna see some people wearing masks in metros, even after they are vaccinated, because it's just too close. Yeah.
Yeah, we'll definitely be watching out for that in places like New York.
Yeah.
I myself have declared to all my friends that if I'm riding the subway, I'll be wearing mask, indefinitely. So one last question. I know you have to run. You focus mainly on U.S. and Taiwan today, and you brought up India briefly. In your work looking at COVID responses across other countries, are there any other structural or historic factors that have really jumped out at you that may be at play in some other countries?
Yeah. I think the most difficult thing for people to grasp is that um, democracies are fundamentally very different than autocracies, and so you can't just do whatever you want in a democracy. That you really need to get the support of the citizenry, and to get that, you need to get at the culture. You cannot just make rules and try to implement them, because people will revolt. And so when I look at the responses around the globe, I try to think of sort of the structure of the country in terms of its governance, right? Like, does one person call the shots, or do you need like a consensus from a group of representatives and so forth, and so and then how do you mobilize the citizenry, and every culture has its limitations. Some culture place a very large sort of their lives on religious activities, and then you have to pay attention to that. And then other countries, they rely on tourism and for as livelihood, and that's very different than manufacturer-based economies. And so it depends on the economy. You also need to consider the strategies for individual countries based on their economic productivity and what their industries are. And so it's really complex, and there's no single answer. You also need to look at the resources of that country. So if you're from a low-income country, you adapt a very different strategy than middle-income than high-income country, both in terms of containment strategy and also in terms of mitigation strategy, and also in terms of vaccine purchasing. And so every country needs to optimize based on its constraints and available resources. And as the whole world needs to optimize for hopefully a quicker reopening of the world where people are protected all around the world. And so I think that's very difficult, because in a pandemic, people tend to say, I'm just gonna focus on my country first, and then once my country is better, then I'll help other people. But there's a lot of international travel, and even though it's more restricted recently in the last year, is to reopen it still need to allow travel, and so that you need to develop strategies for that. So it depends on the resources available, depends on your major economies, your major cultural requirements, and there's no right answer.
Great. Well, Jason, thank you so much. I'm going to bring this to a close because I know you do need to run. But it's been a real honor having you share with us your experience, your keen observations, over really the history of public health and various pandemics. I think this was a really nice international perspective that we're bringing to the audience today. We focus a lot on regional and national responses in prior talks. So I really wanted to have this chance to get the audience to think more broadly and more globally. So this was really, really great. Thank you so much. I also want to thank the audience for attending our grand rounds today. And do feel free to send us additional questions. We'll try to forward questions that we're not able to answer today to Dr. Wang if possible. I think the recording will be made available to everyone. So check the school's website for that. So thank you again, Jason, and we'll be sure to stay in touch and continue to follow your work.
Thank you, everybody. Thank you. Bye-bye.
Thank you, everyone. Have a good afternoon, good evening. Bye-bye.